is reacting to your environment, reacting to what you eat, reacting to the medication that you take, reacting to the stress level. Even the sun today, your body is now, and your gut health is even reacting to it.
Thank you so much for joining us, ladies. So, as we all know, health is very, very important to us. It affects us emotionally, mentally, and physically. And we're always trying to find ways to enhance or improve our body and mind. You know, it's an important topic to discuss, especially during a time where everybody wanted to, lose weight fast with the rise of the Ozempic usage, and it did affect some people. They had bad side effects. So it did help others, but also certain foods don't help some people as well. And there are personalized and holistic approaches to these things to get certain results. So I'd like to start with you, Silvena, Rowe. So you're a biohacking chef, which is very, very interesting.
Thank you.
What is the 80-20 rule, and how can it be applied to nutrition for sustainable wellness?
I started biohacking, just to give a little bit of a history, because I refuse to age. A lot of people biohack because they have a condition, like one foot in the grave, and then suddenly everything is reversed, because biohacking really can stretch from sleeping well, eating the right foods, exercising, to actually going and doing something weird and wonderful with different powders, with different exercises. So the 80-20 rule, what it means is that for 80% of the time, I personally practice with my private clients. I have only a handful because I exercise not just any nutrition, I specialize in longevity nutrition. And I'm now tutoring at the leading college for longevity science in the world in Geneva. And all my students are doctors, they're doing MBA, so we're talking about longevity nutrition, and it's very interesting. Basically, we're talking about nutrition that actually prevents you from becoming sick, much like the doctor was talking about it. I believe in food, I'm a chef, I've been a chef for 38 years, so I really would like to save the doctor's time rather than seeing me. So 80-20 means that 80% of the time we eat with intention, we feed ourselves in such a way that we become this amazing, bulletproof, invincible version of ourselves, and we prevent disease, because it's perfectly possible to do that. And 20% of the time we're not in control. We're on the plane, we are here, I can pick up something from here that I don't know where it came from, etc. But as long as we have this idea of crowding out the stuff that we don't know where it came from, we are okay, because you can't actually live paranoid lives, So, and as longevity nutrition is becoming more and more of a thing, I work now a lot more with doctors. I'm attached to one of the most modern regenerative clinics here in Dubai, where I talk about lifestyle, because most of the doctors don't have the time. They only have 10 minutes allocated to their patients. They don't have the time to go into their regime and into what they have to eat. Especially my subject is female hormone optimization through food. And we now talk a lot about menopause, perimenopause. Those are disasters for most women. I have to say it can be alleviated, it can be eased, it can be made a lot better with the right foods.
That's amazing.
Thank you, thank you.
That's incredible. Razan, from a dietitian's perspective, how do advancements like DNA and microbiome testing enable truly personalized strategies for managing obesity and diabetes?
Thank you. First of all, I'd like to thank you for what you're doing, because actually you complete what we do. Because even if we tell people like eat healthy and do that, sometimes when they don't know how to do it and they think that healthy food is boring and bland, doesn't have a taste, well, this is where you come, and this is really amazing. So basically what I will tell you more today is about, I want to share my story with you. My story as a dietitian. So though I haven't dieted myself, but I've been with every patient throughout the 15 years who were struggling and trying to lose weight, and the failure that they go through and the way they think of it, and they start blaming themselves. Because this is where it started, because people now, they do the calorie, they do the diet, they do the exercise, they do the medication sometimes, and even they go to that knife and the bariatric surgery. But at the end of the day, they still hit the wall and they find themselves unable to lose weight. Or even when they lose it, they go back again and they relapse. And 80% of people actually, as per the American Diabetic Association, is that people relapse after 5 years from losing the weight. So can you imagine the frustration and the effort and the money as well that they have been through, plus the side effects of the health? So this is where I started thinking, like, what is missing? We have the treatments, we have the professionals, we have the resources, we have the awareness, but we are not reaching there. We are not yet treating obesity. On the other hand, every conference I attend, all that I hear is numbers are rising, numbers are rising, numbers are rising. And not only in adults, but now we can see the number of children who are suffering from obesity. And this is where we started talking more about even searching for the 1,000 days before when the mother is even pregnant. So this is where it starts. So this is take me to another thing, which is basically the holistic approach of treating obesity, treating diabetes in preventive way. So basically, we don't want to just look at what we eat, because this is just one part. But what about our genes? And this is where I was introduced to Better. At Better, we do it differently. We don't do it the classic way of just, you come, take your diet plan and go. Because we know that this will not reach you anywhere, because your body is different. The way your body is reacting to the environment is even different. The way lifestyle and the way you live, where you travel, what you do during the day, having an event today will affect your eating habits and will affect your health as well. So this is where it starts. We start first from diagnosis, and always the solution is the proper diagnosis. We cannot just go and tell you eat this and eat that, or my friend tried the intermittent fasting, or the other one tried the GLP injections and they lost weight. No, that's not how we do it. So basically we start with first diagnosis from 3 parts. First one is your DNA. It's your DNA. It's who you are. What are you made up of? And although we cannot change our DNA because we inherit it from our parents, but it's in our hand to change the way the traits on our DNA is reacting and acting to the environment. So that's why when you know the predisposition, you know what kind of genes you have, what kind of genes you want to activate, and what kind of genes you want to deactivate. This is where I understand your inside of the body and what you're made of. And this will take me to a better diagnosis, a better even assessment, and then a better plan for you. The second part is your DNA is not living there alone. Your DNA is reacting to your environment, reacting to what you eat, reacting to the medication that you take, reacting to the stress level. Even the sun today, your body is now, and your gut health is even reacting to it. So this is where we take the second assessment and we dig deep inside into your gut microbiota. And this is the science, because the gut microbiota is actually responsible for 70% of your immunity. For even a lot of research now about the connection between the gut health and even the brain and longevity as well. So treating that big part, because if you think of it actually, your gut is the door to the outside. It is the only way that anything from the outside enters your body. So treating the gut will be 80% of treating your whole body. So we do the second test, which is testing the gut microbiota, and we want to see the balance. There are trillions of bacteria living in our gut, but what are they? Are they living in harmony? Do we have any imbalance? Did I do something today that I have affected my microbiota? So testing your gut health will actually take us to the second assessment, knowing how your body is reacting and what your body is missing in terms of food. And that's just the second part. Then we go to the third part, like, where are you now? What is your health status, your current? Do you have any problem with digestion? Do you have any problem, medical problem, diabetes, or even imbalance in any of the nutrients? So when we have all of these 3 things, we use, of course, as well, the artificial intelligence to analyze all of these data and get you the information that you need, from which we can plan your diet. And we follow up with your plan, and we follow up with your diet and your healthy lifestyle. We talk about your sleeping hours, the quality of your sleeping. We talk about your food, your exercise, even recipes of how you prepare your food. Because even if I give you the instructions, but you don't know how to do it, that will not lead you to anywhere. So this is where Better comes in, and takes all of these things into consideration. And we are not just doing it for individuals. We are so happy to be also doing our program for clinics, for health professionals, for corporates. So we do this program, we tailor it according to what you do. And the difference is that we don't take a ready-made report. We take raw data of your microbiome and of your DNA, and we tailor your report according to your preference and your lifestyle. So you end up knowing your body, knowing what to do, how to apply it. You have also the support and the tracking of the dietitian through it all. So this is the better program. I'll be more than happy. I'll be around if you would like to know more about it for you individually or for your clinic or for your company. Thank you.
Thank you so much. I wanted to just quickly ask you, before we move on to Daphne, that this might be a bit controversial, but what are your thoughts on the insulin resistance test? Because everyone's requesting it,
Yep.
knowing that they do in fact need to do it.
Definitely, we do need to do it actually. We have signs, for example, because there is a very thin line between being pre-diabetic and moving to diabetes, okay? And one of them is insulin resistance, because the thing that happens between, or the difference between insulin resistance and diabetes, in diabetes you don't have insulin or you don't have sufficient. But when you have insulin resistance, your body is producing insulin, but it's not reaching. There's a block. And this block is caused either by your lifestyle or by obesity or by the food that you eat, or even could be your genetics as well, or the gut health. So once you know it, you treat it, and then you prevent moving to diabetes. So do test for insulin. Don't just test, because sometimes they tell me like, yeah, my fasting sugar is good. Well, that's not enough, because fasting sugar gives the information of only today, but it doesn't give me the past period, which is the HbA1c, and doesn't give me information about your insulin. So do test for it if you see signs of resistance of weight loss. And this is what we call the metabolic syndrome, when you have hypothyroid, insulin resistance, and as well the PCOS for ladies as well. Thank you for the question.
No worries. Thank you so much, Razan. Daphne, so Middle Eastern food,
Yes.
very healthy,
Yes.
rich in nutrients. So what role do Middle Eastern superfoods play in preventive self-care, and how can they be integrated into busy lifestyles?
Yes, so first, superfoods. Superfoods are like foods that are high in nutrients. So it's like superpowers from nature, let's say. And in the Middle East, we have a lot of those superfoods, both like foods, but inside out as well. For example, the dates. I think everyone knows dates, and a lot of people like it. Dates are highly nutritious and great for your digestion. So it's easy to implement into your diet to ensure that like your digestion stays healthy. But even the rose water, a lot of people like to cook with it, but you can also like use it on the skin. So that's actually like a Middle Eastern superfood that you can use inside out to heal yourself. And for example, olive oil is also like in the Middle East we use it a lot. Healthy fats. So you can cook, of course, in the olive oil or use it in your salad, and very nutritious as well. And it's an Asian superfood, but matcha. I want to talk about matcha because it's a really powerful superfood that a lot of people know about, but they like the green color, they like the taste, but what it really does is it's, for example, if you drink coffee in the morning, you're like cortisol, but like you will get energy, but you will get a crash as well, like very quickly. But the matcha, it has natural caffeine, so it will give you energy, but like more sustainable. So also like when you like feel that crash from coffee, or like you're looking for more sustainable energy, that's besides like the great taste and the nice color and it looks beautiful, but it's also the health benefits of the matcha. And also it contains something called ECG, which is good for your brain health. So it's also great to implement in your diet.